Hi, I'm Erik Meira from Black Diamond Physical Therapy, bringing you some information on knee pain. Today we're going to talk specifically about anterior knee pain, also known as patellofemoral pain syndrome. Now with anterior knee pain, what we find is that the pain tends to be right around the front of the kneecap, almost always in the front of the knee. Rarely is there any pain on the sides or internally with patellofemoral pain syndrome. Now traditionally, it's been assumed that since the pain is at the knee, that the problem must be occurring at the knee. And studies originally would look at what kinds of differences do we find with patients that have patellofemoral pain syndrome versus perfectly normal and healthy knees with no pain. And the only thing that they could really find was that when the knee bends, the kneecap tends to track out towards the side, so it's a little bit floating out towards the side as somebody's going through activities. This has been something that's been treated in a lot of different ways, and although this does happen in these cases, the treatment has not been terribly successful. A recent study was done where they tried to compare what's known as open kinetic chain exercises, like kicking your leg out, compared to closed kinetic chain exercises, like squatting, in patients that have patellofemoral pain syndrome. What they found is when people just perform an open kinetic chain exercise, kicking the leg forward, that yes, the kneecap does track towards the side on patients with this condition. But what they also started thinking about was most people don't have pain when they're just kicking their leg. They have pain when they're doing squatting activities, like going up and down stairs, or hiking, running, some of these more weight-bearing type activities. Now when they looked at knees performing a squatting activity, what they found is that the kneecap actually stayed right in place. But what moved on these patients is the femur, which is the bone above the knee. So as a person was going through a squat, the knee would turn inward and flex out, which we call valgus. And as you can see, it causes the kneecap to track relatively out to the side, even though the kneecap doesn't actually move. It's the bone behind it moving. So what controls this motion? Well, we've actually determined that this is controlled by the hip. So by treating the hip and getting more strength in the hip and working on coordination, we actually find that we can make this better. Is that the only cause? Absolutely not. But it's definitely a contributing factor. For more information, go to our website, blackdiamondpt.com.